Hi, everybody. I am going to provide you with some information about how we define abnormality when it comes to child psychopathology. We're left with the big question of what does it mean to say something is normal or abnormal. There are three major criteria that we tend to rely on. The first is known as statistical deviance. So a child who displays too much or too little of any behavior at any expected age, for example, dependency or assertiveness, might have a disorder. Using this approach, abnormal behaviors are really defined by their relative infrequency in the general population. So think about it for a moment. Many adolescents have transient thoughts about their own deaths. However, if this is a pattern, if this is a recurrent thought about killing oneself, then this may indicate something more like a mood disorder or suicidal ideation. Now, a major problem with using statistical deviance as kind of a primary indicator of abnormality is that not all infrequent behaviors are indicative of mental disorders. Imagine a child who's tearful, prefers to stay in her room, doesn't want to play with friends, is having problems at school. From this perspective, we might diagnose her with depression because she shows mood problems that are rare for her age. But what if we just learned that her grandfather died a few days before her assessment? Then we would interpret her behavior differently. We would see this as a normal grief reaction. So statistical deviance is one criteria. The second criteria are what we know are what are called sociocultural norms. So for instance, conduct disorder that we'll talk about later in the course is characterized by a consistent pattern that tends to violate the rules of others, the rights of others, the rules of society. So teenagers with this often have histories of disruptive behavior problems that clearly go against cultural norms. Shoplifting, robbery, violence towards others, truancy. Again, however, the chief limitation of defining abnormality exclusively by this criteria is that norms can differ from culture to culture. So here in the West, parents often require young children to sleep in their own beds and in separate rooms. And of course, children who refuse to do this might be classified as having a sleep disorder. However, if we look at non-Western cultures, it's very common for young children to sleep with parents. And actually, it's considered detrimental to their emotional development for them to be separated from their parents at night. So these are two criteria that we use often. And then we have to look at mental health definitions. So for instance, we have to look at things like well-being. We have to look at degree of impairment. So again, defining abnormality simply by impairment can have a drawback. Many people with mental disorders don't show overt impairment in functioning. So a teenager who carefully plans his suicide may show so few problems at home or at school that parents or friends are actually shocked when he attempts self-harm. We have to look at behavioral rigidity. We have to look at psychological distress. And of course, even distress is often subjective. We have to look at competence. Are they able to successfully adapt to their environment, to the demands of their environment? So all of these things become really important in our definition of what is normal and what is abnormal.